Okay, good afternoon, folks. If you're just joining us, if you'll give us a few moments, we do have a fairly large crowd joining us for today's session, so we're going to give folks another minute or two to log in and we'll get underway shortly. While you are waiting, you can go ahead and put in to our chat box. If you will put in your name and organization. And actually, let me ask you to do one thing before you do the chat box. If you know how to change your Zoom screen name, if you can put your first name and the name of the organization you represent, that would be really helpful so folks could know who else is on the line as we look at the little video boxes. If you're not sure how to do that, if you scroll, put your cursor over your own picture, there's 3 little dots. If you click on that set of 3 dots, you should have a rename feature. And that's how you rename yourself. So while we're waiting for everybody to get settled in, name, first name and the organization you represent, and then in the chat box, your name and your organization, and your title or relationship to emergency planning for your organization, if you know that. Like, are you in charge of preparedness for your organization, or are you part of its safety team? Any of those things, or just your name and organization. And okay, it's 1:02. We have 30+ people online. We're express about half of our registrations, but in the interest of time and respect for all of you who joined us on time, we're going to get underway. Good afternoon. My name is Anna Swardensky, and I'm with CADRE, our collaborating agency's disaster relief effort here in Santa Clara County. If you didn't hear my opening remarks, if you could put your first name and the organization you represent in your screen login for Zoom and type in the chat box your name, your full name, and the organization you represent, we'd really appreciate that. If you would like to turn your video on so we can put some names and faces, even just if it's momentarily on, we would like this to be as interactive as we can. We do understand Wi-Fi feeds become unstable, but if you turn your camera on and give us a big wave, you know, so we know you're here, please do that. During today's session, we are going to make use of a number of the features in Zoom. So if you are already Zoom proficient, please bear with us for a few moments. There is something called the chat box, which you are seeing, I hope, pop up. There's a little button at the bottom of your control panel where you can open the chat box. We will be using that quite a bit. Next to the chat box is something called reactions. If you click on that reactions button, you'll see a little thumbs up or a clapping motion. Give me one of those and let me know you found that on your screen. Wonderful. I'm seeing them all pop up. Feel free, if you hear something you really like during today's program, give us a clap. If you want to say something, you can either put your thumb up or in the participants tab. If you click participants, you'll see a full list of everybody logged in. One of the options in the participants tab is to raise your hand. If you'd like to speak aloud in today's program, raise your hand. If Marcia and I don't see your hand raised, just send us a private chat message and say, I've got something I want to say, and we'll unmute you and let you speak to the crowd. So without further ado, I am going to ask us to start off by something interactive with our first participant poll. Oh, gotta do it from my other screen. Give me 1 second. I got 2 screens going here. So I'm going to launch a poll that's going to ask you a couple of questions. The first question is, my agency has responded to the following types of disasters. Give us your feedback. Let's see what you're doing. Are you seeing the poll? Marcia, give me a thumbs up if you can see the poll. Perfect. Okay. And Then the second question, we know who our local emergency manager is. And the last question, you have a clear idea of your agency organization's role in a disaster. Give me a wave if you're done with your poll. Okay. Awesome. Here we go. Share results. Marcia, did that work? Awesome. I'm going to have you grab a picture of that real quick. And now we know who's in the room and what you guys have been doing. And I messed up some of my slides, so bear with me. Okay. So why are we here today? Today's topic is CBO and government coordination in times of an emergency. These are our workshop objectives. How government responds to disasters, where community and faith-based organizations fit in, and more specifically, because this workshop is focused on Santa Clara County, how our local VOAD, CADRE, mobilizes to work with our local government to respond to ongoing disasters and coordinate resources. On this last bullet point, we're going to use later in the program COVID-19 as an example, but I want to stress to you all that today's topic, it's really about the principles of coordination and collaboration in a multi-hazard kind of environment, which is why we asked that beginning poll question about other disasters that you have experienced or responded to. By way of an example, for us here in Santa Clara County, CADRE responded at the request of the city of San Jose a couple of years ago in 2017 for the Coyote Creek flooding event that impacted 3 of our neighborhoods and received a federal declaration. We've been active in a number of multi-unit apartment fires, like the one that took place in Sunnyvale a few years ago, and we coordinate regularly on preparedness and operational times for weather-related events. We have one going on right now for a possible heat event this weekend, PSPS, public safety power shutoff events, and other potential emergencies and disasters. So I'm going to transition to the chair of our board of directors, Marcia Hovey. We're extremely pleased to have Marcia with us today to share with you a little bit more about disasters and whole community. Marcia?
Thank you, Anna, and hi, everyone. All right, first slide. I'm going to talk a little bit just about the history of emergency management for local government, and it'll be quick, but just so that you know where we've come from. Modern emergency management started around 1968 when the Southern California fire chiefs got together to develop a system to manage large wildfires. They had experienced a number of wildfires in Southern California, and they realized that they were dissatisfied with the way the fires were managed, not because they didn't lack resources, but because they lacked good coordination. So they created the incident command system based on the Navy's management hierarchy. ICS is a people management tool, and it works for small and large events. It works for all types of coordination activities, even weddings. And we're going to do a whole session on ICS on August 27th. So if you want to know more about how to manage people in an emergency or a very big event, just sign up for that. Now, ICS was fully developed in the 70s as Southern California had more massive wildfires. And then in 1991, the Oakland Hills firestorm gave us more insights into wildfire management deficiencies. The fire department realized that they had hydrant hose couplings that were not standard throughout the state. And so they purchased adapters so that when outside fire departments might come in to assist them, they could connect their hoses to their hydrants. But the winds in the Oakland Hills fire were so fast moving that fire apparatus had to cut their hoses to drive their engines quickly out to flee the flames and save their lives and protect their engines. And eventually, all of the adapters that the fire department owned were left inside the burn area. And as a result of that, at one point in the fire, Senator Nick Petrus's house burned down because the fire crews couldn't attach to the hydrant. Now, shortly after that, as with many good things that come out of disasters, Senator Petrus sponsored legislation that resulted in the Standardized Emergency Management System that we call SEMS. So now in California, SEMS incorporates ICS to manage incidents, and it also has guidelines for standardizing equipment and standardizing communications. Another great thing about SEMS is that it created the operational area concept so that in California, each of the 58 counties is an operational area. The op area includes all of its political subdivisions and special districts who are all directly connected during planning and response activities. Local governments are required to manage emergencies using SEMS in order to be eligible for disaster reimbursement. Then, September 11th, 2001, the attack on the World Trade Center and the Pentagon happened, and the federal government realized that they needed a better emergency management system. So they took many of the concepts of SEMS because California is often a leader in, we're the Disneyland of disasters, so we have lots of time to test and look at lessons learned and keep going. So they took a lot of the concepts, including the incident command system again, and created the National Incident Management System. Now with the National Incident Management System, NIMS mandates that local emergency plans include the whole community. And in the emergency planning guide for CBOs that we sent out before the meeting, there's a list on page 34 of an example of what a whole community might look like. And I'm sure you can name more. Every community is different, and we just keep identifying more and more players. So we'll be updating this document after we get through this pandemic. So you can see that emergency management keeps evolving. The role of community-based organizations becomes more recognized and valuable with each new disaster. And in fact, this pandemic is the first time that the state held applicant briefings just for nonprofits to help them understand how to recover COVID-related costs that were involving their facilities. So we are making strides. I'm sure many plans are going to be updated with the lessons we've been learning through this local event that has a nationwide impact, and that we can only use the resources that we have right in our backyard. Next slide. So the thing about disasters is that even though there are a lot of players in it, the disasters are local. The local government never gives up ownership or responsibility to manage their disaster. But the structure of SEMS is the same at all levels of government, which makes communication more streamlined. It helps us get to the person we need to talk to faster. And so the disasters start with the local emergency that's normally handled by field level responders. The local responders continue to own and manage that event, but if the situation's impact overwhelms the first responders, or there's a need to coordinate with other organizations, the city or county will activate their emergency operations center. And this is when some of the players start to come in to coordinate a bigger event where they're not managing the field response, but they're managing the impact to the greater community. And then if the city needs support, additional resources or supplies, they contact the county. And if the county doesn't have the resources, they call this the Regional Emergency Operations Center. And if the region needs assistance, they call the state, and then the state can call other states and the federal government. So we don't go outside that chain of command, but we do have access in every disaster except this one, of the resources of the rest of the nation. But even with all those layers, the local government still owns the event and is responsible for coordinating the response. And all of the additional players that will come in, including the CBOs, will fit into that local ICS structure. Next slide. So this is just real quick. This is a sample of it, an incident command system structure. It's an old version that Santa Clara County had. No two org charts are exactly alike, but the purpose of it is to show who reports to whom, and that everyone is included in the information flow, so that information is going up and down the organization, so that even the external partners are making decisions with current information. Next slide. So some assumptions that we make for local government, and I was a local government emergency manager, and I think I can at least speak for myself that when a disaster happens, we need CBO resources to meet community needs that are occurring. And we don't necessarily even know who all the CBOs or FBOs, faith-based organizations, are. So it's important to make that connection. We've seen in every disaster how community organizations rise up, support their clients, and fill gaps. And in this event, think of all of the organizations and volunteers who are just supporting food. Some who never even had food listed as a service that they would provide in a disaster. Our CBOs are flexible and adaptable and vital to our community response. Next slide. This is just a partial list of the expert support services that CBOs can provide. Many of you in this session are providing these services right now, and if you could, please use the chat box and just type in what your organization is doing right now. And it could just be sharing information, it could be running a program, whatever it is. We just would like to see, across the 46 people who are on this call, how diverse it is and how many people how many different things that we're doing in our community. We have so many resources right in our backyard. Let's see. One moment here. Okay, so now I'm going to give it back over to Anna.
Okay, thanks, Marcia. So Marcia mentioned the concept of whole community planning. And so in some of our communities, there is a network of local service providers that we often use the acronym CBOs, community-based organizations, or FBOs, faith-based organizations, or just the more generic term of nonprofits that work together in times of an emergency or a disaster. Using your Zoom reactions, give me a thumbs up or a clap if you've ever heard the term VOAD before. A few of you. Okay, awesome. So for those of you that this is a new term, VOAD stands for Voluntary Organizations Active in Disaster. CADRE, who is putting on this workshop today, is the local Santa Clara County VOAD, and I've personally worked with a number of our local VOADs across the Bay Area region. A number of them have joined us on the line today. I see Ron from Alameda County is one of our partners. We have a number of other folks in the room, I think, with us from outside of Santa Clara County. So as Santa Clara County's local VOAD, CADRE mobilizes both our CBOs and our FBOs to work together and connect with state and national resources when a need arises. So to give you an example of that, I mentioned earlier the 2017 Coyote Creek floods in San Jose. When CADRE was activated, one of the issues that we knew was probably going to come up was the issue of insurance. And one of the national VOAD member agencies is a group based in San Francisco called United Policyholders. And their mission is to be a trustworthy and useful information resource and a respected voice for consumers in all types of insurance in all 50 states. They don't take money from insurance companies. They give disaster victims the straight scoop, and they help folks to navigate the insurance claims process and fight for their rights. We called United policyholders immediately after CADRE was activated in 2017. We let their staff know what was happening for us here locally in our community, and that we were planning to convene one of our interagency coordination meetings. And with less than 24 hours notice, they were there to help us on the ground in our meeting here in Santa Clara County. So that's just one example. They were there for all of our North Bay neighbors throughout the fire season. That's just one example of how we are able to mobilize resources that maybe aren't in Santa Clara County, but are part of our state or national VOAD network. And so through those connections, we can bring resources in to help rebuild our community and plan for longer term recovery needs and help our most vulnerable community members. So we have strong working relationships with our state and national VOAD partners. I think today on the line, we also have representatives from our voluntary agency liaisons from the State Office of Emergency Services. We work closely with our FEMA voluntary agency liaison, and for the last 10 years, or for a number of years, we had their partnership in our annual CADRE Together We Do Better conferences. And they were helping to explain who does what in an emergency. But what can local VOADs do? Well, CADRE has been actively organizing here in Santa Clara County for over 15 years, so we have a pretty robust network. I want to do a shout out right now. We have quite a few of our emergency managers also online, and it is really due to their support that we've been able to build the capacity of our nonprofit network here in Santa Clara County. So type in the chat box if you were active with us for the 2017 floods. I think some of you, I recognize organizations, maybe it was your predecessor, but there's a lot of you on the line here that your agencies or you yourselves were active with us. So use the chat box. Yep, I see a FAST team member. FAST stands for Functional Assessment Service Teams, Conservation Corps. Great. So what are some of the things that we can do as part of the activation? Some of the things that we can work on from how CBOs can help a government jurisdiction is with the assessment of needs from the incident and what capacities we have here locally to respond to those needs. We can work on ongoing and regular coordination with our jurisdictions and the community agencies and services, provide a forum for them to come together and share that information. We have within our community, within all communities, a lot of local service provider expertise, trust, guidance, and give recommendations to our local jurisdictions and help with everything from the needs assessment through to the after action reviews and recommendations that come from any event. That's how we exemplify whole community. And so with that, I really want to move us to our panel that we have worked on together to bring to you for today's purposes. And we wanted to talk and allow you all to talk together about how do community-based nonprofits work with local government in times of an emergency. And so to kick that off, we had asked for Kip Harkness, the Deputy City Manager in the City of San Jose, to share with us a few of his thoughts. He's actually taking a much-deserved vacation this week from COVID-19, and we absolutely respect that. And he was generous enough to record a short little video clip of his remarks that he wanted to share with you all about what his thoughts are on CBO and government coordination. So if you give me just a moment, I got to switch screens and I'm going to play Kip's video for us. So give me one moment. Oops. And then we're going to go to that panel you see on your screen. So one moment. And here we go.
Hello, I'm Kip Harkness, Deputy City Manager for the City of San Jose. And since the 24th of January, 2020, I'm the city's lead for our pandemic response to COVID-19. Welcome to the workshop on community-based organizations and city collaboration put on by CADRE. I wanted to share a little bit of a perspective from my role as the director of our Emergency Operations Center on the importance of the role of CADRE in this particular disaster and the complexity that we'll be facing together in the months ahead. We've had as many as 720 people fully activated in our Emergency Operations Center, performing tasks from supporting our community-based organizations in feeding to supporting our most vulnerable homeless residents, finding shelter and staying clean and safe. It has been a tremendous amount of work, and we could not have done it without our partners at CADRE and the community-based organizations they represent. I think 4 things about COVID-19 make it particularly hard. One is that it's a disaster that's everywhere at the same time. Normally, a disaster will happen over here and we're able to shift resources and bring them in from elsewhere and back up the local community. So if there's a flood, Rubicon can come in from somewhere else, muck out some buildings, and then go on to the next flood. But in this case, it's as if everywhere is flooded at once. And so we are completely dependent on our local resources. And therefore, CADRE becomes even more important because we must mobilize ourselves in this response. The second reason that COVID-19 is particularly hard is normally we would go from response to recovery. We'd pivot. Now there's a little bit of an overlap between the two, but you move from one mode to the next. Now with COVID-19, we are in response and recovery at the same time and have to be ready to go back to a higher response mode any week if we get a spike in cases. It's extremely difficult. I think CADRE's strength in that regard is that the community-based organizations are dealing with the hardship of recovery all the time. So this is in some ways nothing new to them. They know about an ongoing crisis. This is just the volume turned up. So CADRE is well prepared to help us with this ongoing response and recovery. I think the third reason it's really hard right now is that it's only going to get harder. Sheltering in place and turning off services is a hardship, but it's relatively straightforward to do. Opening up services and coming back out and doing that safely is even harder, especially because everybody who has not already gotten COVID-19 is by definition at risk. So the better the job we did in the early part, the more people we have at risk in the later part. And this is going to go on for months and months and months until we get a vaccine that is safe and effective and until that vaccine is scaled to everybody who needs it. Again, I think CADRE and community-based organizations have shown time and time again that they are agile, they're nimble, they're resilient, and they're able to adapt to changing environments like the one that we find ourselves in right now. And so their partnership with us, again, becomes all the more important. The fourth reason I see this as being harder is that this disaster is dramatically unequal in its consequences. All disasters, we know, disproportionately affect the poor and most vulnerable. COVID-19 seems to have doubled or tripled down on that bet. Our Black and Latinx community in particular is suffering a vastly disproportionate number of the deaths, of the cases, and of the impact on the economic crisis as well as the public health crisis that's going on. Add on to that a fiscal crisis, which causes counties, cities, and others to have to cut budgets designed to support exactly those people who are most vulnerable. And you have this triple threat of public health, economic crisis, and fiscal crisis, which is potentially devastating our communities of color. CADRE has known this all along. The CBOs that are part of the network work day in and day out with the most vulnerable and know our community intimately and know their strengths as well as their struggle. So again, in this moment, that becomes extremely, extremely important. In response, you want to do fast. You want to get stuff out there. In a recovery, you need to do with. You need to figure this out together. So I see CADRE as a core partner in our recovery, as a whole community. And I welcome the opportunity to be part of the thinking and the design and the collaboration and the coordination that goes into working with our community-based organizations as we shift into recovery while still being prepared on the response. Good luck with the workshop today. Remember to take care of yourselves, be safe, take a deep breath, and appreciate the fact that we are all allowed to serve our community in the moment that they need us most. I'm very proud of the work that you all do. I'm really grateful to be part of the team. Thank you.
Okay. Oops. Hold on. Sorry, that's what I get for having multiple systems running on my desktop. Try not to give you some audio feedback. Okay, so hopefully what you see on your screen is the panel that we are really excited to bring to you all today as part of our CBO and government coordination. We have an exciting panel of speakers that you see on your screen. We have prepared them with a couple of questions that they've been preparing some remarks to share with you. But we do have, a lot of experts in this room with us. And while we ask 6 of you to share your remarks, please do use the chat box and share with the rest of us in the room your own perspectives and your own answers to some of the questions that we're posing to the panel, so we can all learn from one another and build on that. So successes and challenges, we're all here to learn from one another, and I'm going to get started with our first question to our panel, and I'm going to direct this one at Hillary Armstrong, our CBO liaison at the County Administrator's Office. Hillary, can you talk with us a little bit about the history of working with community-based and faith-based organizations?
Sure, and good afternoon, everyone. Thank you so much for being a part of this conversation. And just to give you a little bit of background about myself, as I came into this work, my first experience with emergency response work was as a CBO partner during the 2017 floods. I was at the Law Foundation Valley, and I think we have some representation on today from the Law Foundation, and that was my introduction to really a lot of these concepts that Marcia and Anna outlined so helpfully. And I worked in the local assistance center and city response, and that was just a really rich experience in terms of learning how emergency response can respond to our community, and especially to help those who are really disproportionately impacted by these disasters. So I welcome Daryl as well to pop in with any kind of county history, since I'm actually new to the county. I've been with the county for a little over a year now, and spent probably a quarter of my county career in our emergency operations center as part of the COVID-19 response. But what I can say is that the history of working with CBOs and FBOs is a rich one, and this is very much echoing what Kip had to say. The CBO community has such an important and critical role in any emergency response, and the government partners absolutely cannot do this without you, and your expertise and your ability to pivot nimbly and speak to the needs of particular communities is incredible. So we're grateful for that. I think there's certainly challenges and roadblocks and bumpy parts of our journey. And the other thing I guess I would say is kind of a theme is that we're all learning together. And so I certainly am no expert whatsoever. I have some experience lived in disaster response, but I think, there are many, city and CBO partners and county partners who have way more experience than I do in this area. But what I do know is that it's about communication, and where we really rely on our CBO partners is raising our awareness of needs in the community. And I think that has played out a lot in the COVID response, and sometimes with some stumbling on our part as government. And so thank you for your flexibility and your graciousness in continuing to communicate with us and hold us accountable. But I think one area in particular that I can think of is with the health disparities and disproportionate impact of COVID-19 on certain communities. And it's really, as Kip said, this disaster is really unlike no other. And so I think really partnering with our CBOs, with the Eastside Peace Partnership and other folks on the ground to really understand how we can address this crisis that is so challenging for everyone, but really, really, really devastating for certain communities, and how we can try to save lives together. So I know there's much more to talk about, but those were some of the themes that I wanted to kind of cover, and especially that open dialogue and communication. So.
Thank you. Thank you, Hillary. So Ray, how about a few remarks from your perspective? Can you share?
Thank you, Anna. It's always hard to follow KIP in any way or shape or form. I've been working with him for 3 years, and I've learned that you never want to come behind him. You always be one in front of him. But I do appreciate the remarks that KIP had. And what I really want to point out is where we were at and where we're going to. And along with those themes that Kip and Hillary were bringing out is that we cannot do this without you. We have not ever done it without you. And as Marcia opened up with a little history, I've been at this since 1986 as an emergency manager in Contra Costa County when we first faced floods in 1986. And I can clearly and simply recall I had 4 CBOs that I had to connect with. There was the American Red Cross, there was the Salvation Army, St. Vincent de Paul, and Loaves and Fishes. That's all I needed to communicate with. At least that's what we had in our playbook at the time. And then, of course, as Marcia indicated in terms of the history, as time went on, we realized how many others we were not including. It's not that they didn't exist. It's that we didn't know how to reach out to them as a government organization. We didn't know how to engage them. We just knew that somehow they popped up and took care of things. And I think it's part of the development of working with nonprofits and the CBOs and the various groups is it's great that they're there, but if they're not engaged before, it makes it difficult during and after. So we need to take more time during the blue sky days to have that opportunity to do a few things, because we saw a number of things happen that were challenging. We as a government organizations, we look to CBOs to fill a need, but then we also count on that response as part of what we call our portion or our response with FEMA. When FEMA gives us funds, that's only 75% of the cost. The state comes in and gives 75%, if they do, 75% of the remaining 25%, so we have 6%. And we can count the costs of those CBOs with the FEMA reimbursement if it's done properly. But if it's not done properly, if it's not clear through an agreement, and if the right signatures and the right things are not in place, that doesn't count. We are also there to help and support, and with agreements can be a supporter of that local CBO if they're going above and beyond what they normally do. Again, part of the reimbursement process. What does that mean? It means we have to have agreements in place, we have to have protocols in place to make it more seamless, but it's not going to be seamless without practice and without dialogue like this we're having today. So those very important themes, but we still need to continue to understand and learn about us from the government side. Who are all our CBOs and what can they provide us? Because we do need to reach out to those most affected, who typically are our most vulnerable populations. And we need to fill those needs appropriately. And even with this broadcast, we have to start thinking about those who are blind and cannot read. How are we providing enough information to them? How are we providing information to those of multiple languages that we don't speak, but we need to reach out to and engage and make sure that they're whole in the end? So we have a lot of questions on our side. I'm sure all the CBOs have a lot of questions on their side. This is a great opportunity to bring those questions together to start figuring out a path forward. So that would be my movement for all of us as to what can we do next to help each other. Because as Kip said, we're all in this together and it ain't over yet. It ain't over yet. It's going to be a long time before this one is past us. And we have to be able to get through this and address the needs we have. And thank you, Second Harvest Food Bank and all the other CBOs, and the great need in the food distribution that we've had during COVID response has been tremendous, as well as reaching out to the other support needs we have in the community.
Thank you, Ray. Thank you for being with us. And I'm going to switch the next question over to Daryl Ray with our County Office of Emergency Management. Daryl, the question was, what do you expect from your partners when you think about working with our community and faith-based organizations? You were, I think, the first person that called us as COVID was starting to show in Santa Clara County. So give us some thoughts, Daryl.
Yeah, great. Thank you very much, Anna. And I also really appreciate the opportunity to be here to participate in this webinar with the community, with the wider community. It gets me out of the EOC a little bit, so I doubly appreciate that. So when I'm calling CADRE, I'm looking for a few different things. There's the reason why I'm calling, and usually there are three reasons why I'm actually picking up the phone and making the phone call. Number one, CADRE is full of solid, experienced, educated emergency managers, and at the very least, I know that I can share, the situation and what our thoughts are. And we have an established relationship with many of the emergency managers in CADRE, and I know that I can rely on them to provide me with really good, rational feedback on whatever it is that we are. Maybe it's a plan, maybe there is no response going on and it's a blue sky day, and we want to make sure that we're getting as much comprehensive feedback from the community as possible. The CADRE represents, and CBOs, FBOs represent the community at large. So instead of it just the plan being what do I need to do as a government agent, it is what does the community need me to do as a representative of the government. And so we're not pushing stuff down onto people, that we are listening to folks and then including that in our plans. So that way it's more likely to actually transpire that way. I can guess all day how the community is going to react, but without getting their feedback, it's an uninformed guess, and I'll likely be wrong. So just on blue sky days, CADRE is there to have a ready-made audience for providing feedback to our office on what our intent is moving forward. So if we're action planning, so we plan on doing something next week or tomorrow about a particular disaster that may be occurring right now, or whether it's something that is more hypothetical, like an earthquake that we don't know when it's going to happen. CADRE is made up of folks who are great to give us feedback on those ideas. Additionally, with that, they find a place for themselves. CADRE will do that. If you're keeping CADRE in the loop, including its CBOs and FBOs, that sort of stuff. If you're keeping all those folks in the loop, they will self-identify where they can fit into the operation. So oftentimes I might not know that there is a place for CADRE, but just by connecting with those people to get their feedback, oftentimes they will self-identify where they could help out. So there have been times where I've called CADRE for during the Loma fire, or during the floods, or during a PSPS event, or during COVID, and I might be calling them for one particular reason, but as I'm briefing them on the general situation, they can tell me what resources they have available to help with a particular problem that I wasn't necessarily looking for, and that's great too. The easy one is that you guys are the long-term recovery organization for Santa Clara County. So that's the textbook handoff, the transition that Kip was talking about in his video. The government is there to respond and then mitigate any of those immediate hazards, and then to and with the long-term recovery organization, push the community into recovery, and utilizing CBOs and FBOs to really handle the bulk of that recovery work. But also, and I think probably for the biggest reason is that there are gaps in governmental services, and there are roadblocks with bureaucratic processes that FBOs and CBOs just don't have. So if it's somebody who, a homeless individual or a vulnerable family, that sort of thing, needs transportation in the middle of the night, and I know that there's nobody from the county available that I can call to get them from the hospital because they've just tested positive for COVID to a hotel for isolation, that I can call CADRE, and they are more likely to be able to quickly respond to a need like that wasn't pre-identified. Sure, I can set stuff up, and as soon as it's set up, I can pull the trigger on certain things. But if something isn't set up, preloaded, there's a lot of bureaucracy to go through when I need something inside of an hour or something like that. And CADRE is there to provide that less bureaucratic approach. When I'm working with CADRE, so that's why I would call CADRE, but what I'm expect when I'm working with CADRE is similar training if we can. So having gone through ICS, SIMS, NIMS training, so that way they can effectively find a spot in the EOC and make themselves at home or at the field, understand who it is that they're talking to and why they're talking to that particular individual. I'm looking for responsiveness. So if you're going to raise your hand to take on a task, then we want you to be accountable for that task that you have volunteered for. So if it's a food issue, then providing timely reports on your operations, how it's going, what your needs are, so that way we don't find out after the fact that once it's become a problem that you had a particular need. So responsiveness, and generally a cooperative relationship. In EM, when we are dealing with disasters, especially during the response phase, it's always a pickup game. So who's not on vacation, who's not out of the area, who is relative to this particular disaster, whether it's a flood versus a fire. You might have subject matter experts that are different, but collectively, there's always going to be a new team of folks. So, and there's always overlap, but it's never exactly the same players. So you need to come into the disaster response phase, recognizing that it's a team sport and that everybody has a role that's valuable, including yourself, including your organization, and to cooperate with the other agencies that are there. And what I really need, finally, when it comes to working with especially CADRE, not just a singular CBO or FBO, but CADRE really provides for span of control. Ray mentioned having to coordinate a few different CBOs back in '86 in Contra Costa, and he said it that he was coordinating 3-4 CBOs, which is tough enough and during a complex disaster, but CADRE has access to dozens of CBOs and FBOs, and it would be really impossible for us at the EOC to have any kind of positive control or understanding of what all those individual agencies are doing and what they're not doing, where there might be duplication or gaps. And that's where CADRE really comes in. And instead of talking to 20 different agencies, we just talk to a single agency that coordinates itself. So that's a big plus for us with CADRE. Additionally, we look for these folks to serve as trusted agents. So it's not just the government with this top-down approach saying this is how we see it up here in our ivory tower. Well, we're not an academic institution, but to borrow a metaphor, we're not just sitting up in this ivory tower and making decisions and pushing it onto the community, but really using the community to co-develop the ideas and then to move through those ideas together as government and community. And that's what these community-based organizations are there to do. They're there to provide that perspective for us. We also need to have relationships before the event. Ray mentioned that as well, that it's important to know each other before the response happens. It's difficult working with any agency, particularly when they aren't the same type. So I can understand another governmental procurement process. It's probably similar to mine. We have similar rules, that sort of thing. Whereas a CBO or FBO might have totally different processes that I'm unfamiliar with, and I'm not going to know unless I've spoken with you before the event and I've gotten to know you a little bit. And then finally, as Ray mentioned, the recouping the funds from FEMA, the recovery dollars. So we need to have good documentation, who worked on what, when you worked on it, and how long did you work on it for, what equipment was used. So that way we can leverage that documentation and submit it to FEMA to get everybody reimbursed on the local level. And that is the answer to my question.
Thank you,
Thank you.
Very robust answer. We really appreciate it. I'm going to switch gears for a moment and move to some of our community-based representatives. We asked some of our CBO reps to think about, when they are thinking about working with government, who do they work with? How do they work with them? I'm going to ask Sherry Burns, the Executive Director of Independent Living Center. Sherry, can you talk with us a little bit about your relationship with government, with utilities, and how the Independent Living Center is working collaboratively?
Okay, hi everyone. Good afternoon. So Silicon Valley Independent Living Center has a long-standing relationship and MOU in place with CADRE. We are a founding member of CADRE, so we have actually 3 decades of history working in collaboration with our local CBOs and FBOs and our government partners. We have a long-standing, also decades-long relationship and MOU in place with Second Harvest as a supplemental food site. Matter of fact, this was the first service that we reopened on site at our both of our offices, our main office in San Jose, and then we have a branch office that serves the South County, and it's located in Gilroy. And in late April, with help from Second Harvest and a couple of other partners, we were able to acquire the PPE necessary for our staff to safely provide bags of food for many of our consumers who were just, having a hard time getting to other locations to pick up bags of food, or maybe they didn't have a vehicle that they could drive over to some of the grab and go sites. So we stocked up more on food during that time, and we're able to open our offices 3 days a week for a couple of hours each day by appointment for folks to come by and pick up bags of food for themselves, for their caregivers and family members. And our numbers of people quadrupled during that time, beginning in April, and they continue to be much higher than they have been in the past. Also recently, we engaged in an MOU with the Health Trust to provide some home delivered meals to some of our frail elders and people with disabilities and people with chronic health conditions that are being, needing to shelter at home during this time and cannot again readily access some of the senior centers or churches that are partnering with Catholic Charities, or the food bank for grab and go lunches or boxes of food. Many folks don't have access to a vehicle for them to get to those locations, and it would be unsafe for them to leave the house, especially if they're living on their own and don't have a family member or caregiver to pick up food for them. So we're also starting to provide some home delivered meals through the Health Trust with an MOU with them. Some of the new contracts and MOUs that we have in place are with our statewide membership organization. There are 28 centers for independent living in the state of California. Silicon Valley Independent Living Center is the Center for Independent Living that serves Santa Clara County, but our membership organization is the California Foundation for Independent Living Centers. And before I go on, there was a chat question that came up. I'm sorry, we always speak in acronyms, don't we, in every field. MOU, Memorandum of Understanding. It's like a very simple contract or agreement with a partnering organization or a government entity. So we have one of those simple contracts in place with the California Foundation for Independent Living Center and PG&E, and it is a pilot project after what we could probably all agree was somewhat of a disaster in itself with last year's PSPS events. PG&E was required to and promised to do better this year, and they have put many, many new protocols in place and agreements with CBOs throughout the state. One of those agreements for a pilot is actually with the Centers for Independent Living in the state of California. And thank you, Anna, for putting in PSPS, Public Safety Power Shutoff. And that we are working together collaboratively as independent living centers covering the whole state of California to address the needs of people with disabilities and health conditions and our older adults who are the most vulnerable during a public safety power shutoff. Now, folks that are extremely vulnerable are those that rely for their health and safety needs, and sometimes it's life support needs for electrical powered equipment, or because of a health condition, they need to have their home cooler or warmer. So folks that have health conditions that require the use of gas or electricity, or they utilize some type of equipment for their health needs, and that could be a BiPAP machine, a CPAP machine. It could be that they're a power wheelchair user or a scooter user for their mobility. It could be they utilize a power-assisted bed, like a hospital bed, any number of, or they have medications that require refrigeration. For example, somebody who's diabetic. They could qualify for reduced costs for their energy. And that is called the Medical Baseline Allowance Program, or we call it MBA for short, but the Medical Baseline Allowance Program. And this is something that anybody, it's not means tested, so it has nothing to do with income. Anybody who has a need for additional power, whether it be electricity, gas, or both, can get that at a reduced rate. So they get more kilowatts of power at the reduced tiered rate level if they qualify. The application is very simple, and especially now during COVID, people can apply without having a doctor's certification on the form. It's a self-certification, and they can send that in to PG&E, and or they can get help through SVILC, my agency, to fill one out and get on the MBA program. The other advantage for folks being on the MBA program is that they will be at a higher contact level for PG&E if there is a PSPS, public safety power shutoff event that's going to be occurring. So they will not only get a phone call, but if they get text messages on their phone, they'll get a text, they'll get an email. The more ways that they have to contact that individual, they will attempt many, many times to contact them. And if they cannot reach them, they will send someone out to contact them. They're also part of our partnership under this new pilot project, is that we are also a front line for contacting the folks that have signed up through this program. So we're already have quite a lengthy spreadsheet of folks that have signed up for this new pilot project with CFILC and PG&E in order to help folks prepare best for these PSPS events. Some of the things that through this project we are providing is not only that information referral and contact and assistance with signing up for the medical baseline allowance program, but also to help people develop their own personal disaster plan. So we will go through a whole series of questions and discussions with folks to help them develop their own family disaster plan. And then lastly, if in fact they are in our area in Santa Clara County and they're going to be in a tier area that is going to be affected or may be affected by a PSPS shutoff event, is that we can provide them with backup battery system. We're utilizing a lithium, large capacity lithium battery, and that can be loaned to them during the PSPS event, or even ahead of time, long-term during the season of possible power safety shutoffs. And so they can have that available to them to continue operating their equipment. And if they don't, if they can't benefit from a battery, we can also put them in a hotel or motel and even transport them and provide them with personal assistant services as well as food during that time that their home is without power. So that's just a couple of various MOUs that we have in place and different projects that we are working on with our partners, both in Santa Clara County as well as throughout the state of California.
Thank you, Sherry. A wealth of resources, a wealth of information to share. Next up, I wanted to call on Mylin Pham with the Asian American Center in Santa Clara County. And if you could talk to us a bit about what you have seen as some of the coordination successes and challenges, if you've seen any. Tell us a little bit about things from your perspective. Mylin?
Good afternoon, everyone.
Perfect.
Yes, can you hear me?
Go ahead.
Good afternoon, everyone. Okay. Good afternoon, everyone. Thanks for allowing me to share my thoughts today. So Asian American Center is a small grassroots 501c3 nonprofit organization that was founded in 2002. And our mission is to assist and empower families and individuals through advocacy, social support services, economic development, as well as learning opportunities. And as part of our COVID-19 response, we are proud to be working as a community partner with Destination Home and Sacred Heart to provide direct financial assistance to low-income families who's lost income as a result of the pandemic and are struggling to cover rent and other basic needs. So our part is to disperse $175,000 to financial assistance to eligible residents. I just want to share a quick story with you. About 2 weeks ago, one of the participants that received the financial assistance from our agency called me. And he said that he was very grateful for the financial support. His wife and him, you know, they want to use that money to cover for her medications because she had cancer. Unfortunately, just a week after that, his wife passed away because of cancer. So he called me just to tell me how grateful his wife and he received a financial assistance program, but then he used that money to cover for his wife's funeral costs. And it touched my heart so much because every day, you know, I would go to Santa Clara County to open the dashboard to see the number of how many people passed away because of COVID-19. I would see how many people tested positive for COVID-19. I would go to the city of San Jose and see how many homeless are being placed in the shelter. So we are involved in the numbers, but we don't really realize that we're actually, you know, touching people. So, I mean, I think, you know, what we are going through right now is so historic, and I'm sure that it will be written in the history book for 100 years to come. So when the COVID-19 pandemic hit early in March, my team and I knew that there's much to be done in response and recovery, and that our delivery services will increase tremendously. Although we were preparing to assist, because we are so small, we didn't know how to contact the city or county to collaborate our works with them. Since, again, we are a very small grassroots organization, immediately I contacted Marsha for help. And as you know, nonprofit organizations' involvement in disaster response require the collaborative capacity of multiple sectors and jurisdictions. And collaborative capacity building is a very difficult task for small nonprofit like myself. Capacity building and effective performance require fostering relationships and forming creative teams and network. And since that call to Marsha, CADRE has played an instrumental tool as our one-stop provider system navigation. I have learned that CADRE emerged from the 1989 Loma Prieta earthquake, and one of its primary goals was to create a support system, to create a better system to organize the different types of CBOs that may help with response and recovery in a disaster. So I hope that CADRE will build its infrastructure in the most definite way, that it continue to be an umbrella organization to bring all of us, especially small nonprofit like mine, to go through this pandemic, but not only for COVID-19, but for other disaster. As we see, we in August, by September, October, November, we're looking at the flood seasons as well as the flu season coming up. So we're very grateful for CADRE work. And because of CADRE, non-small profit like myself can be able to actually interact with the local government level, which we have never dreamed to have it happen. So thank you so much, CADRE. Thanks so much, Marsha and Anna, for all your support and help and energy that you put into this pandemic. It's truly amazing. Thank you.
Thank you, Mylin. And so we thought that was a really wonderful capture of everything from our small nonprofits serving, very important populations, sectors that sometimes aren't on everybody's radar. Our next speaker I asked to give some remarks is kind of the other end of the spectrum, one of our largest nonprofits in Santa Clara County. Bruno Pillay is here with us from Second Harvest of Silicon Valley. And Bruno, can you share with us a little bit about some of the coordination efforts that your agency is doing, both with your nonprofit partners and with local government? Bruno?
Yeah, good afternoon, everyone. So just briefly set the context. Obviously, what we do today in nature is pretty much what we do all year round, which is to basically distribute food to people who need the food. Since mid-March, obviously, what has happened is that the need has grown extremely fast. So right now we are distributing food to more than 500,000 people. It's been like that for the last 3 months. It's going to be again the same for this month, the month of July, and then we'll see how August stands. And when I say we, obviously it's not just Second Harvest. Second Harvest, by tradition, works with a very large number of partners of all kind and size. We have more than 300 of those partners. They could be churches, they could be community service agency like in Sunnyvale, Mountain View, all sorts of, and that's the way we accomplish our mission. A few things I want to highlight, which I thought were kind of different this time with the kind of crisis we've been in since mid-March. And compared to what I would call the more traditional disaster for which we used to prepare with CADRE, which are typically a flood, a fire, earthquake, things like that, which tend to be an event that rattle through the community rather fast, and after that is just, okay, how do you help the community recover from the situation? And that's what really takes a long time. Here, right now, the crisis is just, I would say, never ending. It's just still there and there and there every month. And so it's a matter of, it's really a long distance running. Every week or every month could be different, not only because the pandemic could be hitting a different level, increasing, decreasing, more shelter in place, less shelter in place, but also government, more help, less help, no help. And all of that is driving basically the need, and therefore for us, disaster response. With that in mind, I want to highlight a few things, a few examples about how we have worked with various local governments, and I think they will illustrate really how flexible everyone has been to the process. Typical disaster, usually the local government tried to organize the overall response, the shelters, and they may have asked to us, and we see if we can answer. Here was really much more two-way street. So we had, for example, to set up big emergency drive-thrus, which has been our way to distribute a lot of food very fast. And so we had local government like city of South San Francisco, for example, stepping up and helping us finding a location and setting up a volunteer team to distribute the food. They volunteered their police force to do all the traffic that we had created over there. We had the city of Daly City Park and Recs coming to us and offering vans and drivers to deliver home deliveries. At the very other side of the spectrum, we had obviously state and county coming to help us. We had to change completely our way of distributing food and pre-box the food to minimize the interactions between volunteers and clients. And that would not have been possible without the California National Guards stepping in. So obviously it started from the higher level, the funding of the National Guard, the designations of the units, and then the units themselves showing up pretty much every day in fairly large number. I think at some point in time we had something like 70 or 80 guards working in our warehouse to do boxing of food. Now we're down to 30 or so. When the National Guards assignments was coming to an end, the county helped us getting access to, oh shoot, the group is just escaping my head right now, but it'll come back. To basically a group of volunteers. Thank you, Dorothy. The San Jose Conservation Corps came to actually fill in the role of National Guard. They're here every day. It's great to see those kids because they're really kids being there and getting ready in the morning for their shifts in the warehouse. We had slightly different interactions with Gilroy, the city of Gilroy, and Charmaine from the, I think she's from the youth violence prevention function over there, help us identify gaps that were in terms of need and availability in Gilroy. And so we're still working with them, which may be a longer term engagement, which may go beyond just the response to COVID. So these are just a certain number of examples that were set on the fly, I would say, with sometimes individuals in functions which are pretty far from what they're helping us with and helping us really making it work. So I think it's only a great part of the response. On the other side, I would, if I may, also highlight the not so good interactions where sometimes you have some, let's say, people in some element of government, elected officials or not, who may want to step in and say, oh, that's the way you should do it, or that's what I want, or so trying to really pursue goals which may be very good for their end, but may not be necessarily for the better good of the community and or not necessarily being done from a place of knowledge. and therefore may try to get us into doing things that either are not making sense or not really the most appropriate for the community and so on. So I think that's the kind of interaction I enjoy least. They are often there, unfortunately. I know it's not new because I had heard that same kind of feedback from people who had been in other kind of disasters like fire in particular, where they may get a lot of pressure, which are not necessarily the best help that you could have. So if I may point that out as well, I think that's an important element of collaboration. And obviously there were elements of fundings, which is obviously a key element, not necessarily to us directly, but to partners. There are some number of things we've been able to do because some other non-profit organization were able to jump in, but they had to use their own employees for which they need to have the funding. And the city of San Jose, for example, working with the rest of the local governments, were able to set up some funding mechanism. So indirectly, you have this kind of help, which obviously goes a long way into helping us achieving our mission. So maybe that's really what I want to highlight from the food bank, and it's not over.
Thank you, Bruno. And thank you to all of your team for the great work that you continue to do and the extra long hours. So I want to call out to everyone on the call. If you have a question for the panel, if you want to type that in the chat box, and we'll see if we can't get any questions or comments addressed. I did ask each of our panelists to prepare one kind of closing statement, and because I asked you to prepare that, I wanted to give you a moment. If we could give each of you just 1 minute to tell us if you could change one thing, make one change that would make it easier to work with your opposite sector. So government working with CBOs, CBOs working with government. If you could change one thing on your wish list, what would that be to make things easier? Let me start at the top. Well, I'll start with Ray.
That was a quick one. Wasn't quite expecting. Okay. Yeah, the one thing is I brought up some of the challenges earlier, and I think one of the things that really strengthen our movement forward is having an understanding. Bruno made a good point, is sometimes our vision and direction of what needs to be done is not always in connection with the CBO and what they see as the needs of the community. So I think we need to come to a common understanding of what we expect and how do we communicate and how do we work together to provide the needs for the community that we see at home. We don't have all the answers. We can't do it all ourselves, but we certainly need the CBOs. We need to figure out that way of the best path forward for requesting, for filling the need, and identifying the need that needs to be filled.
Thank you, Ray. Daryl or Hillary, anything you want to add from government to change to work better with CBOs?
Go ahead, Hillary, if you're ready.
I think it goes back to a mutual commitment to kind of over communicating. And I know even within our own kind of EOC and county operation, that's been a challenge. So I think just committing on both sides. So I think as government partners that we'll keep trying to communicate, and that as CBO partners, you won't give up on us either, especially as you're raising these really critical issues.
Okay. Anything more you want to add to that, Daryl?
Sure. So I was in my role here at OEM, I was managing the training and exercise programs. So I wish I had more of an opportunity. I was there longer to be able to do something like this. But I think we need to have, a focused exercise on recovery where we actually exercise the transition from the response of the government and passing on that, moving through the phases into recovery, and to see what that looks like. Most exercises, almost all of the exercises, restrict themselves to a response phase to test governmental services. But I think that we really, really lack that recovery exercise where we transition from one to the other. So I'd like to see more of that.
Okay, thank you, Daryl. Sherry, what would you like to see changed if you could change one thing?
Okay, so I think what I'll share is that invite us to the family dinner table for planning and response discussions. We are fun and knowledgeable people. I think it's that if we're making decisions about the residents in our community, we need to do it together as a team, not made in a vacuum. The CBOs and FBOs really know their constituents, and they can help government entities with developing plans that are culturally inclusive. And lastly, not to forget the public, members of the public that have lived experience with emergencies and disasters, to be part of the planning and the discussions as well.
Thank you, Sherry. Mylyn, anything you want to add?
Yeah, I just want to add one last thing is I just wanted to kind of just piggyback to what Ray was saying. I think it's important that county and city emergency directors need to have clear working relationship with nonprofit organization involved in disaster management, actually before it happened, then, you know, like going to put the fire away. I think, and also, you know, not only working closely with the leading nonprofit such as American Red Cross or Catholic Charities, but you know, many other small nonprofit organizations are also provided services to disaster-affected population as part of our mission. So if you can please work with us, and I think that's where CADRE plays such a pivotal role in getting all the nonprofit together, working under CADRE umbrella, you know, to really combating what we are doing right now. So I think, and I think it's such a good generous way right now for us to have the opportunity to sit together this afternoon and talking about you know, the dialogue with CBO and government. But don't forget to take time for yourself, breathe, smile, and be happy and stay healthy. Thank you.
Thank you, Mylyn. And Bruno, rounding back out to you for any closing comments on your wish for.
No, I think based on my experience, I would say as long as each side, both CBOs and local governments, come from the place of how can I help, because every side has something to offer to serve the public. I think everyone also has the best interest possible of the community they serve. So it's really this how can I help attitude. And I think if both sides are coming that way, we usually end up in a good place.
All right. Thank you, Bruno. There have been just a couple of questions in our chat box. I'm going to ask our panelists to take a quick glance in the group chat while Marcia and I continue on to offer a few more thoughts on this topic. If you all have any answers to the questions posed, by all means, please share your thoughts and perspectives. So with that, I'm going to turn it back to Marcia, and we have a couple more things to share with you before we close out today's program. Marcia?
Sure, thanks. So this is just now kind of wrapping it up for Santa Clara County, and a lot of it we covered. So good job picking the panel, Anna. So I won't have to say as much, but the first slide is how CBOs can help local government for cost recovery. And even more than cost recovery, it's like, how can you help local government? One is don't self-deploy unless you don't want to get any reimbursement or support from the jurisdiction. Because one of the biggest nightmares when you have an emergency operations center is you have people out in the community doing good work, and the emergency operations center doesn't know they're there. And so they may decide that that service needs to be provided, and then they'll go to the trouble to develop a system and provide that service and then realize it's already happening. So it's really important to either let CADRE or the jurisdiction know that you have this ability and get them to say, okay, yes, do that for us. Because they may have already gotten someone else to offer. You know, it's just making sure that there's communication there and that you're just not doing it on your own. Because if if you do get their approval and then you need more resources, then you're already in that pipeline to get the resources. And then working on making sure that you do get agreements in place if it becomes a long-term thing, or it is sucking all the resources out of your organization that you would normally use in a year, and it suddenly disappeared in 6 months. In the guide that we sent you, the emergency planning guide for CBOs, on page 31 to 33, it does talk about memorandums of understanding. Just based on what we've learned during this event, we're going to be updating that, but it's a good starting point if you're, for you to ask questions of us and of local government. And then you can, as Ray mentioned earlier, your volunteer hours and staff hours can be a local match. So Ray mentioned that there was a 6% of the total cost of the disaster, of this disaster, that will come back that the city doesn't get reimbursed for. So 6% of who knows how much. But every volunteer hour can be an offset. It will reduce that amount. And right now, the volunteer hours value is $31.51. So the CADRE website has a sign-in sheet that shows you how to track the hours properly so that you can give those, even if you don't have a contract. If you are supporting the response and you have used volunteer hours, you can submit those timesheets, and we can help our government not have to be in the hole as badly as they're going to be. In addition to that, some of your donations and items that you used out of your inventory can also be tracked and shared with the government as a kind of an in-kind match that will reduce their costs. And next slide. And then how can the government help the CBOs? Well, as I mentioned, the CBOs have, they're using all of their resources for the year in about half that time. And so anytime that they can get an extra contract to cover the costs as they're going forward, or if you find private sector resources or other government resources that could be helpful to them, that will mean that they'll be around after the disaster. Next. Working with CADRE, let's see. Real quick, just those who are, I'm sorry, I just went blank on what I was going to say on that. Notification of partner organizations. So make sure that you are keeping everyone in the loop. The coordination meetings. So now I remember. So when CADRE gets requested to activate, and sometimes it actually starts with one nonprofit getting a phone call, and the nonprofit calls us and says, this is going to get big. So it's either a government or a nonprofit calling that something's needed. We notify all of our partner organizations. Now, if you don't know if you're a partner organization, I'm going to put in the chat how you can join CADRE, which is free, but you just add your name to the list. Then we'll have the convening meetings like we're going to have this coming Monday to hear what the status of the event is from the government perspective and the status of the event from the nonprofit perspective. Then we'll do special meetings and trainings like the one that we're doing now. And then we have a bunch of them on our website that are related directly to COVID. And then we will be doing recovery meetings and trying to figure out how to get back to normal, and we will be sharing the best practices. Okay, now we're going to blow through these last slides really quick. Let me put these links up. So this is to reach the duty officer. This is what you do. You can call 408-622-0822. This is on the CADRE's main homepage. So if you go to cadresv.org, you can get it there. Next. CADRE does, nonprofits are classified into different functional teams. So there are leads of the functions, but then everyone that performs similar services work together. That way they can help each other as well as help the community by being stronger together. So you can just see some of them that are activated during this event. And then on the left of the screen, we have an activations page, and each of the functions has a listing of resources that they have identified and posted for everyone to review. So you can go there, and that link is in the chat. I already mentioned this is where you can get the websites and webinars through the programs and events link. Next. Oh, there's a bunch of the webinars. They're broken out. One is COVID-19 webinars that are specific to this event, and then the other are general preparedness webinars. And it's more than just the recording of the webinar. A lot of the times we've created additional resources tied to them. So all of the links to the PowerPoints and everything are on the website as well. And it's 2:30. And I'll let Anna talk about this evaluation. Pull your phones out right now.
Yeah, so thank you to all of our panelists. Thank you to Marcia and our founding CADRE members, our collaborative peers on the line with us from other counties. What you see is a QR code. If you'll pull out your phone, you can scan that with your camera. It will take you right to our participant evaluation survey. Please, please, please take just a few moments. It's only 10 questions long, and give us your feedback. Our funders are on the line with us today. They do want to hear how well these kinds of preparedness workshops are meeting your needs, helping to move you along, building your resilience and your preparedness. So if you'll give us your feedback on today's program. As we showed you on the previous slide, if you go to the CADRE webpage, there's more information about the upcoming series of workshops. Next week on Friday, we'll do the same topic focused on Monterey, Santa Cruz, and San Benito with different speakers and different content on that community. At the end of the month on Thursday, August 27th at 1 o'clock is our in the morning on Thursday the 27th, Understanding Incident Command System for Nonprofits. Please join us. We're going to try and really make that fun, see what we can do to bring a tabletop type exercise to a virtual environment with you all. That's our goal. And then coming up, just so in case you haven't yet seen our flyer for our series, in September, we're going to focus on supporting nonprofits in their continuity of operations planning. And the other topics coming up are on disaster volunteer management. Molly Tobias, if you're still on with us, I'm going to be calling you. We have volunteer management, donations management, and then we will be repeating the first two topics that we started in July, which is how do you prepare your own organization and prepare your staff personally to be more ready and resilient. And with that, we are 2 minutes over. Thank you all for sticking it through with us for 90 minutes. We welcome your feedback on how we can improve, and all of your good works continue. Don't forget to join us Monday if you're actively involved in COVID-19. On the website is the registration link. We've got 120 plus people logging into that Zoom to share with us what's happening for COVID-19 in Santa Clara County.
Great, thanks, Anna. Thank you, everyone.
Just us. Sorry about the echo. I realized that a little bit later. People didn't really use the chat box as much as I thought.
Yeah, I was surprised.
Yeah, that was weird and different, but I think our panel was really robust.
Yes. No, I took a bunch of notes. They had really good things to say.
Oops, we can turn our recording off too.
Oh. Okay, note to cut off the end of the video. Okay, so it's downloading onto my computer right now, so I'll
Perfect.
put it in the Dropbox, I guess.
Is it stopped? Did it stop recording? Looks like it's
Oh no.